Alrighty. Good evening, everyone, and thank you all so much for being here. I want to welcome everyone to this wonderful event where we are highlighting forensic pathology as a specialty. The plan for tonight's session is to last approximately 1 hour with a Q&A session at the end. This talk will be recorded and posted on the Virtual Pathology Student Interest Group's website, which is virtualpathsig.org. My name is Seth, and I'm a fourth year medical student at Rush University, and I am so excited to be moderating this event tonight. Without further ado, let me introduce our speaker, Dr. Mark Giffen. Dr. Giffen is a board certified pathologist with over a decade of experience in forensic pathology. He received his medical degree from Lake Erie College of Osteopathic Medicine and did his residency training at Wake Forest. He then went on to do a fellowship in forensic pathology at the University of New Mexico, and he then returned to Wake Forest, where he now serves as program director for their pathology residency. His research interests include forensic radiology, firearm-related injury patterns, and complex medical legal death investigations. Dr. Giffen is actively involved in medical student education and currently runs the Pathology Scholars Program to help students gain exposure to the field of pathology. And on a personal note, I have worked with Dr. Giffen through the Pathology Scholars Program, and it is obvious that he cares deeply about his trainees' education and their success, and that he truly loves to mentor and teach. So we are so happy to have you here, Dr. Giffen, and I will hand it over to you.
Thanks a lot, Seth. I really appreciate that. So let's just dive right into it. I'm going to talk to you all today about forensic pathology. So I wanted to first start with how I got into forensic pathology. A lot of people who get into forensics have kind of a unique story to tell. There's some common themes that end up kind of running through for a lot of different people, whether they had family members in law enforcement or somewhere in the medical field that interacted, or they've had a personal experience with forensic pathology. So I actually was born on Staten Island, which is the forgotten fifth borough of New York City. And my father was a New York City police officer. He had a unique role. He actually was a police sergeant in the medical examiner's office as part of their missing persons program. So when somebody dies in New York City, there's millions of people that live there and visit there every single year. It can be very difficult to try and figure out who someone is, especially when they come in with no identification and few identifying features. So part of the police department at the time was actually embedded in the medical examiner's office, and they would help to identify people who came in as John and Jane Does. So the first time I actually ever set foot in a morgue, I was 5 years old. Now that's to say that it wasn't actively in use. My dad just brought us in to get paperwork on a weekend, but he didn't want me to be afraid of what he did. He wanted me to understand that death is a part of life. His other job that he worked in was as a funeral director, which I actually spent some time in when I was in high school and college. I kind of grew up around death as just a normal part of life. So I came through undergrad and I decided I didn't want to just do research. I was a biology, psychology dual major. And I decided, I wanted to go into medicine and do something that was a little bit different. So I went through medical school. I tried a lot of different hats on. I really liked ENT surgery, but I decided that the lifestyle probably wasn't going to be a good match for me. And I decided that pathology was, in fact, probably going to be where I wanted to go. Now, when I got into pathology residency, I still kept the doors open because I wasn't sure if forensics was going to actually be what I wanted it to be, or if it was just, the pipe dream of what people see on TV. And so I decided to try out everything. I actually really like transfusion medicine. I like cytopathology a lot, but forensics is what kept calling me back. And I'll talk a little bit about why that is as we go forward. So, just to start, in case you don't know what forensics really deals with, forensic pathology is a field of medicine that determines cause and manner of death. And when I'm talking to a jury, what I basically mean by that is how and why people die. That's what I'm trying to determine. So that way I can give the best information to family members, to law enforcement, or anyone else that may be interested. Why is that important? They're dead, right? That we don't need to know these sorts of things. Well, there's actually a lot of reasons that that's really important. One is epidemiology. Why do we know that heart disease is the number one killer of people in the United States? Because of death certificates, because of the information that we get from doing autopsy examinations. Why did we know COVID was so deadly? Because of the information that we got from doing those examinations. It's important for family closure. Now, that could just mean, somebody dies suddenly and they're not sure why. An autopsy examination may be able to give you pieces of the puzzle to be able to determine exactly what's going on. Maybe it means that their family carries a heritable mutation that they may need to go and further investigate. Maybe they need to be monitored more closely to make sure that it doesn't impact them. And even just getting a death certificate itself is important because that allows you to settle an estate that may allow for benefits to carry on to other family members and a variety of other things. And then, of course, the legal system, which is what most people think about. When a crime has been committed and someone dies, we have to collect evidence and we have to determine, again, how and why that person died. So that way, when we go into a court of law, we do not introduce any reasonable doubt. We can say that this is, in fact, why this person died. Sometimes that's really easy. It could just be one natural disease process or one specific injury, or sometimes it can be really complex with layers upon layers. And that's a whole different discussion in and of itself. So, why forensic pathology? And for any of you that are M3s, M4s, you've probably been asked why pathology. And you've heard all of the tropes before, right? You don't like patient care. You don't like talking to other people. I will tell you, I probably talk to people more often than some other specialties do. I talk to families all the time, lawyers. I talk to um, uh, police officers. I talk to my death investigators. There's a lot of overlap, and we really do have to have really good communication skills. I actually loved patient care. I just didn't see that as what I wanted to do for the rest of my life. I really liked working with patients, and I still see myself as working with patients. It's just in a very different capacity. I'm not working for the patient in the sense that they're a deceased person, but I am working for the patient's family and being able to give them the answers that they may need. There's also the trope, especially for forensics, that you just couldn't cut it in any other field or subspecialty. You're not good at surge path, so you're just going to do forensic pathology. Well, actually, forensic pathology is probably one of the most complex fields of pathology that there is right now because there's subspecialization in almost every other field of pathology. Think about surgical pathology. There's literally an organ system dedicated to every single specimen that you could get, and some of them are even subspecializing beyond that. In addition to that, many places have gone to subspecialty sign out. There's very few places that do general sign out unless you're in a private practice anymore. And then above and beyond that, there's a fellowship for every single one of those subspecialties that you can get into. Forensics, I get the entire body. I have to figure out exactly what killed somebody, whether it be the heart or the lungs or a thyroid or their brain or an injury pattern. I'm a jack of all trades and a master of some. Admittedly, I can't diagnose every single tumor like I did when I was in residency, but we really have to know a lot in order to get to the right answer. You are secretly a serial killer. Well, being that this is recorded, I obviously can't say yes to that. But there are a lot of things that I probably couldn't do anatomy wise and the in depth investigations into the human body that I do get to do as a forensic pathologist, which is part of what drew me into the field as well. So, what did draw me in? One is diagnostics. I absolutely love it. It's medical detective work, and in many ways, pathology in general fits that bill. It's the practical application of anatomy and physiology. I loved anatomy coming through medical school. It makes a lot of sense to me. I can think 3D spatially, which definitely helps a lot in this field. And physiology, though it ends at death, a lot of the mechanisms about how people die relate back to the physiology, thinking about, let's say kidney disease and the breakdown of glomeruli and getting to actually see the scarring in a kidney as the physical manifestation of that. I like talking to people. Like I said, I have to get on the stand and testify, 6, 10, 12 times a year. And I also have to talk to family members and to law enforcement and to a variety of other people as well. I like histology. I think everybody who goes into pathology definitely enjoys histology. I jokingly tell medical students coming through that if you go into radiology, you like black and white. And if you go into pathology, you like color. I know that that's not entirely true. There's a lot of color in radiology too. And there's plenty of black and white and pathology. And then I like to teach. And a lot of what I do as a forensic pathologist, I see as teaching. So when I get on the stand, I see that as teaching the jury what I know about how someone passed. It's also important to remember that even the dead have stories to tell and things that they can teach. In many medical examiners' offices or teaching morgues throughout the United States, you may see this this Latin phrase mortuae vivos docent, and that means that the dead teach the living. That's how we've gained so much medical knowledge by doing anatomy dissections. That's how we knew what cancer was originally. That's how we know anatomic variants. That's how we know what congenital heart disease is because of the work that's been done previously. And there are still a lot of things that we can learn. And there are still a lot of things that we are going to learn by being able to examine the deceased and figuring out exactly what led to their death. So, what does the education pathway look like for forensics? It's very similar to most of the rest of pathology. So, obviously, medical school for 4 years. Pathology residency can either be 3 or 4 years, depending upon the track that you pick. You can do an AP only residency. There are fewer of them in the United States. It doesn't really limit your ability to practice, although I would say, especially if you had the focus of becoming a chief somewhere at some point, you may want to do a 4 year residency that includes anatomic and clinical pathology. The main reason for that is that any office that has a toxicology lab that is certified and validated, if your head toxicologist leaves, a lot of times the person who takes over for that person is the chief, and they have to be CP certified in order to run that laboratory and to keep it going. It can be very expensive to send toxicology out if you don't have somebody to fill that role, or to pay somebody to fill that role on a temporary basis. And then a forensic pathology fellowship for 1 year. There's plenty of people choose to do other fellowships. Some people will even pair forensics with surgical pathology, so they'll do part-time forensics or autopsy pathology in a teaching setting, and they'll do surgical pathology sign out. A lot of times, pediatric pathology goes very well. Cardiac pathology, neuropathology are the common ones that you'll often see if people choose to do another fellowship. So, what does it take to be a good forensic pathologist? First and foremost, you need to be a good pathologist. There are some people that kind of get hyper focused and just want to get to the forensics. And I always tell them, you need to slow down and you need to take a break, because we deal with literally every component of the human body. That also includes blood. That also includes chemistries. There's a lot of postmortem testing that we need to do. So, first and foremost, become a good pathologist. Forensics can come after. So you want to choose a residency program where you can get good, competent training, preferably one with good exposure to forensic pathology, whether that is going to a state office or if you have in-house forensic pathology opportunities. And then obviously some place where you're going to have the opportunity to get a good enough education to pass your licensing and boarding examinations. Forensic training is definitely a plus. I'm sorry, definitely a need. And you have to go someplace with a wide variety of case types and experiences. You don't want to go someplace where you're just going to cut one or two types of things, mostly natural deaths, which actually can be some of the most complex things we do. But you want to have plenty of opportunity to see the full breadth and depth. Where we're located in North Carolina, it's the western part of North Carolina. So I tell people probably the only two things that you aren't going to get here are a desert death and a shark attack, because we don't have an ocean, but you'll see pretty much everything else, and you can kind of figure out the other stuff on the fly. We have large bodies of water here, so you get recreational water type deaths. We have a few small private plane crashes every year. So there's plenty of different things that you'll want to get exposure to during training, because you don't want your first job to be the first time that you get to see it when it's really all on you. And then you also want to be curious and to ask questions, because that's what our job is as a forensic pathologist. It's why. Why did this happen? And getting as much of that information and thinking outside the box, especially when you have difficult cases, can sometimes get you to an answer. So a medical examiner, a coroner, and a medical legal death investigator walk into a bar. Why did I start a joke like that? Well, it's because a lot of people don't know the difference between those things. Those words are often used interchangeably, and I'm just going to clarify them as we go through this. So, what is a medical examiner? Now, there is some variance to the use of that term. Here in North Carolina, medical examiner, we have local medical examiners that do death investigations. They're more in line with what a medical legal death investigator would be in most other places. Most places, medical examiner is synonymous with forensic pathologist. They are a person who investigates deaths. They do an autopsy examination. They'll prepare a report. They'll go and testify in court, and they will also complete death certificates. There's a variety of other job duties that'll obviously come along with that. But when you hear medical examiner, for the most part, think forensic pathologist, so a medically trained doctor. A coroner. Coroner is actually an elected position. Anywhere in the United States that there is a coroner system, that is an individual that is elected to determine how and why people die. They're actually the ones that fill out the death certificates. Their office is the one that is going to do the investigation. So, what's wrong with that? Well, there's a wide variance in what coroner systems actually mean. Some of them are very good, don't get me wrong. Some places have great training. They have the opportunity to really get people that understand what they're doing, and they may actually use people that are medically trained, either doctors or something else in the medical field. Other coroner systems, maybe not so much. In some places, the only requirements to be elected coroner are that you are at least 18 years of age and are willing to sign an affidavit that you believe in God. That is that is it. That person could be working at a funeral home. That person could be a used car salesman. And not saying that those individuals might not necessarily do a good job, but they probably don't have the background and training to necessarily really understand what's going on. There are also a few jurisdictions in the United States that have sheriff's coroner systems. Medical examiner systems are at least supposed to be truly independent investigators. A sheriff's coroner system is a coroner that is actually embedded in the sheriff's office and is part of the sheriff's office. So there's obviously the potential to have overlap in investigation and for there to be issues that may arise with those sorts of things. Again, I'm not saying that that happens in all cases, but the potential does occur. And then what's a medical legal death investigator? Medical legal death investigators are people that are trained to perform death investigations. They can be trained in a variety of different ways. We actually have some in our office that came from law enforcement backgrounds. We have some that came from medical backgrounds. And then we have some that were just trained as medical legal death investigators. There is a national society, the American Board of Medical Legal Death Investigators, or ABMDI, and they actually certify medical legal death investigators. They do continuing education, they do initial education. So these people are very well versed in what they do. They often are the people that you probably think of when you think of a crime show that goes out to the scene. Now, there's the crime scene people, those are for law enforcement, but the death investigators are the people that come out from our side. They will go out in North Carolina, at least, a crime scene belongs to the police, but the deceased person belongs to the medical examiner. So they're the ones who get to examine the body at the scene. They'll collect evidence in concert with law enforcement. If there's immediate evidence needs that need to be collected, then they'll collect evidence. They'll follow up. They'll get us medical records. They may interact with families, whether that's true interviews or just phone calls back and forth. We as medical examiners may also go out to the scene depending upon what's going on. And in some smaller jurisdictions, medical examiners may be the only people that go out to scenes. But that's generally the breakdown of the difference in the jobs that we do. So, as a forensic pathologist or a medical examiner, where can you work? So, there's really three options. One of them is a jurisdictional medical examiner or coroner's office. So, what that is it's going to depend on where you are. Some states actually have a state medical examiner system. So, where I trained in Albuquerque in New Mexico is a state medical examiner system. Every single person who dies in New Mexico and falls under the medical examiner's jurisdiction and it requires an examination will come to the main office in Albuquerque and get that examination performed there. Here in North Carolina, we have a kind of a decentralized system that's very similar. We have the Office of the Chief Medical Examiner in Raleigh, and they are in charge of sort of the central part of the state. And same thing, they are legally charged by the state legislature to investigate and perform examinations in certain types of death as defined by law. They may be also smaller jurisdictions. It may be county, it may be a group of counties, it may be just an individual city. So it just depends on the size of the jurisdiction, the population, and really it comes down to who's paying for it and how. An academic center, which is where I'm at. So we at Wake Forest are a regional autopsy center for North Carolina. So we perform autopsy and autopsy examinations and assistant investigations in 33 counties in Western North Carolina, which is about a third of the state by landmass. So we do see a fair amount of a variety of different cases, as I already mentioned. And so anybody dying basically from the Tennessee state line all the way to more or less the middle of the state is going to come to us for an examination. And then you can also do private practice or consulting. Most people don't jump right into that out of the gate. They get some experience first. But you may have heard of plenty of people who do private autopsies or they go and testify for a variety of different civil type things. I've done some consulting myself. It just depends on what your preferences are. Generally, that's outside of your regular employment. Some people take things up on the side, or as they near retirement, they'll take more consulting work. But some people, there are just private practices that'll perform autopsies for coroner systems or individuals. It just depends on the way that things are set up. So, what are some of the positives and negatives of forensic pathology? So, positives, it's an excellent job market right now. If you are unaware, we are at about a 50% capacity. You can pretty much get a job anywhere that you want, and that means salaries are also on the rise. Now, a lot of them are government jobs, so that stagnates a little bit how high that can go. But we have about 750 practicing forensic pathologists in the United States, and by 2030, we expect the need to be about 1,500 based on population and other legal needs throughout the United States. That isn't going to change in the next 4 years. As a matter of fact, we're still losing forensic pathologists because there are more people retiring than there are actually coming into the field and staying in the field. There's a variety of different reasons for that. One is that this job is just not for everybody. Pay has historically been a bit of an issue that's significantly increased over the past couple of years. And it may be a little bit location restricted, and we'll talk about that in a minute. It's a very interesting and engaging work field. Some of the most interesting cases that I've ever had are actually the ones that I least expect them to be. Interesting on anatomic variants. I had a case within the last 2 months of cytosine versus totalis, and one of my forensic pathologists in my office has been in the field for 35 years, and he said he'd never seen it before. So it's some of those things that you just never know what you're going to walk into and find. It's very rewarding. It can be hard. I won't lie about that. But finding an answer when you don't know what the answer is, being able to bring justice if you that's something that's important to you, being able to tell a family and know why your loved one died, it's giving them a closure in a way that a lot of people don't really realize what that means. And we're also the coolest. You can tell every other pathologist that I said that. I'm sure I'm going to get plenty of hate mail, but I really like forensic pathology, and I think we're some of the coolest people out there. Negatives, it certainly can be gross. I don't think that there's a single forensic pathologist in the entire world that would tell you that the decomposed body is something that they enjoy doing an autopsy on. There's a lot of things that go along with that. I won't get into all the nitty gritty details, but you can imagine, and you either can get over it or you can't. Like I said, this isn't for everybody. Some people really don't like court testimony. I will tell you that every time I testify, and I've done it dozens of times now, I still get nervous. The first time I ever went to testify, my Fitbit told me as I was sitting, doing absolutely nothing and just waiting to get on the stand, that my heart rate was in zone 2 and that I was doing a great job exercising. You get over that with time, but it's still a little bit nerve wracking. But I get on the stand and I put myself in what I call teaching mode, and I'm just teaching the jury and the judge and everyone else in the room what I already know, and my heart rate comes right back down, and I'm right where I need to be. Resources can also vary pretty significantly. In some jurisdictions, you're doing bare bones and you may not necessarily be able to do everything that you want to do just because the money's not there. Oftentimes, forensic pathology and medical examiners or coroner systems are paired with one of two things. One is the Department of Justice, and the other is the Department of Health. And there's a lot of things that they want to do to keep people alive and to keep people in or out of jail. And forensic pathology doesn't always make it to the top of that list, depending upon what the jurisdiction's needs are. Locations can be restricted. Oftentimes, you're not going to go to some backwater town. If you always wanted to live in your hometown, population 250 people, you probably don't have a forensic pathologist there, and you're probably not going to be able to work. So oftentimes they're around cities. I found a nice happy medium here in Winston-Salem. I'm not a big city guy, even though I was born in New York City. But you can also have the opportunity to live in a big city if that's something that you do want. And it is still medicine. So it does come with some of the drawbacks and the hassles that come with having to deal with being a physician. All right, so what's our typical workday? It's really not that typical because it can be pretty different, but I'm breaking it down into 3 parts because there's sort of 3 different things that we do. The first of which is the autopsy. So we don't do autopsies generally every day. We are often on schedule so that we have the opportunity to perform them either a couple times a week or a couple times a month here in my office. I'm actually on service this week, so I'm the main person who's doing autopsies. I did 4 autopsies today, earlier today. It depends on the complexity. It depends on the needs. But we'll go in there, we'll perform our examinations. So what does that entail? So it's an external examination that includes photography and externally reviewing the body, creating diagrams, writing down identifying features, any injuries, any medical therapy that's there that may be conflicting or maybe something that we'll need to explain. We may also collect evidence and give that over to law enforcement. We're not the ones who keep that. We're not the ones who test that. That's all on law enforcement. Then we do an internal examination. So we're going to open up the body. We're going to examine basically everything. We're going to look in the head. We're going to look at the brain. We're going to look at all the organs from the neck all the way down to the pelvis. And then sometimes we'll need to do specialized dissections. So, for example, if we have somebody who had a pulmonary embolism, we might not want to know what the origin of that is. So we might do a leg dissection and look at the veins in the leg to determine if a deep venous thrombosis had occurred. If we have somebody who is a pedestrian struck by a vehicle and the vehicle left the scene, we might do additional examinations on the legs in order to determine the potential vehicle height. So there's lots of different things that we may do. We can basically look at the entire body. And then we take those notes, we prepare them, we write a report with it, and then that report will then get used in the future. So that goes to the office work component of it. Most of what I do is not autopsies. Most of what I do is actually in the office. So that's going to be things like reviewing histology. That's going to be reviewing testing, making phone calls, following up on medical records, reviewing those medical records, and finalizing my report, finalizing a death certificate, and getting all of that information together so that way it can then be released to whomever may need it. So again, these are some of the things. Also following up on investigations, making phone calls, asking additional questions, and then also things like toxicology, microbiology, vitreous chemistries, genetic testing, whatever it may be that we need to follow up on. And then, of course, there's getting into the courtroom. So this is a minority of what we do. I'm actually under subpoena for court for this week. It looks like it probably got continued, but generally, it's a whole lot of waiting around to get on the stand for a very short period of time. Most of the time, it takes longer for me to actually testify to my qualifications as an expert witness than it is to actually tell a jury why somebody died. There are certainly cases though where I've been on the stand for 4 and 5 hours answering questions. So who do I work with? So first and foremost, families. I'm here for the deceased family. Obviously, the deceased isn't here anymore. They don't care what the answers are, but I'm getting answers for the family. I'm also here for the legal system. I work with lawyers. I work with both district attorneys and defense attorneys. I work with civil lawyers. I work in a variety of different capacities, even if it's just answering basic questions about a case that I'm not involved in. So there's a lot of different things that we can be involved in there. Obviously, we work for the medical examiner system, which is a government entity. So there's some other things that we may do. We may be involved in working with things like child protection or decreasing gun violence in our communities, advocating for those sorts of things, as well as resources that we need. Law enforcement, we work with them to help determine probably the biggest question that we get is, did this person die from natural causes, or was it drugs, or was it some manner of violence? I had an individual today that I autopsied who was deceased. The house was a little bit disheveled. The door was unlocked, which was a little bit weird, but there weren't any obvious signs of injury. And they just kind of wanted to dot the I's and cross the T's and make sure that it wasn't a violent death and we weren't missing something. And then other physicians. I actually spend a fair amount of time talking to other physicians about why their patients died, what the ramifications may be, and answering questions that they may have as well. So, what skills help you in this field? Anatomy and physiology is definitely going to be a key here. It's knowing not only the normal, but also what is abnormal, and what is abnormal but won't necessarily result in death. There is not an autopsy that I do that somebody does not have some variety of anatomic variation. It's part of who we are. Most of the time, that means absolutely nothing in the context of why an individual dies. A couple times a year, I get horseshoe kidneys, most of the time in people that never knew that they had them. We find, anomalous coronary arteries. Most of the time, they don't actually mean anything. Sometimes they're actually cardioprotective. There's a variety of different things that we can find. So it's knowing not only why it's abnormal, but also, does it mean anything in the context of why this person is deceased? Also, pattern recognition, just like anybody who's going into any of the diagnostic fields, radiology, pathology, you need to be able to recognize patterns and what they mean. So that may be disease states. So what are the symptoms that led up to this person having having their sudden collapse? Were they complaining of chest pain, shortness of breath? What things might I want to rule in or rule out based on those? Symptom progression. Did it start suddenly or did it have a slow and insidious onset? Both of those things mean different things. So I tell our residents all the time, you have somebody who drops dead suddenly. It's one of three things. It's the heart, it's the brain, it's the lungs. Those are the three things that kill people quickly. Any other organ system generally is going to come on pretty slowly. The liver, usually liver failure will kill you in a couple of days, not a couple of seconds. The kidneys, same thing. So thinking about what is the progression of this disease and what could that possibly mean in the context of the symptoms and what this person had from a social or other medical diagnoses is really important. And then injury patterns too. So sometimes the question is this a homicide or is this a suicide? Does the injury pattern make sense? Well, most people who commit suicide aren't going to have a whole bunch of other injuries. That may lead us down a different pathway, which may lead to additional investigation on the part of law enforcement. So pulling all of these pieces of information in and understanding it, but also not just jumping down a rabbit hole, is a really important component of being a forensic pathologist. Excellent documentation skills. If I put something wrong in an autopsy report, even if it's as small as saying somebody had a appendix and they had actually had an appendectomy, that calls my report into question. If I mess that up, what other things could I mess up? Or could I have intentionally done wrong? And all of a sudden, there's doubt about why this person died this way. So could there be a reasonable doubt that this person could have died from something else? And so having good documentation skills, having a good eye, and being able to communicate well is really important there. Taking that documentation and being able to use it to be able to, again, teach the jury. So most people on a jury have an eighth grade reading level or below. So when I talk to a jury, I spent years in medical school and in residency and in fellowship learning all of these big words that none of them understand. So how am I going to take what I know and I'm going to teach it to them in a way that they can understand it? And then there is a degree of emotional resilience. There are cases, no matter what you do, that will be difficult. Nobody likes to do a pediatric homicide. Nobody likes to do a child abuse case. Nobody likes a pregnant woman that dropped dead, all of a sudden. And it does take emotional resilience. There's a wide variety of different things. Almost all forensic pathologists I know are really good at compartmentalizing. And we talk to each other about these sorts of things. It's not a normal part of life because a lot of people don't talk about death, but it's a normal part of our lives. Complex cases are honestly the most fun. Doing a straightforward single gunshot wound is boring at the end of the day. It's just taking a couple of measurements and being done with it. It's when I find something that I really have to use my brain to work onto. And every case has the potential to be a complex case because sometimes the information you get just isn't what you think it is. Or sometimes the information that you get is incomplete. Or sometimes you just don't have any of the information because the person's dead and they were the only person who knew what happened. So I treat every single case the exact same way. I examine them the same way. Now, I will sometimes do more if it's more complex and I think that I need to see more. But I start the exact same way and I look at all of the same things and I look to rule out all of the same things. I document things the exact same way every single time. And I approach every case with the same curiosity. Um, I find out more information when I don't know and I don't think that I have the full answer. Maybe I'll go back and look for more medical records. Maybe I'll talk to more family members. Maybe I'll ask additional questions of family members that I didn't ask the first time. Maybe that means tracking down additional resources, doing additional testing. That add-on testing is really important because we do a standard set of testing, but sometimes you need to go an extra level above that in order to really be able to get the answer. That may be things like genetic testing. And then we rule out as much as we can. Sometimes we just can't get to the answer. Physiology ends at death. And sometimes the death is actually due to a physiologic process. So we don't have anything to go on. But we might be able to rule out a variety of other things and say that, it kind of comes down to it's probably related to the heart. We don't know exactly what's going on with the heart, but it's most likely a cardiac cause of death. And we've ruled out most of the other things. This is a little bit of a sad case, but an interesting case. I actually had a 13-year-old boy who had come home from swim practice about a week prior, complaining of a sore throat. And it was swim practice. It's in the winter. They just said you probably got a viral upper respiratory tract infection. Just treat it symptomatically. Well, over the course of 3 or 4 days, it hadn't gotten any better. And he went into the emergency department. And they did the full gamut of testing again, strep and flu and all that, and it all came back negative. And the next morning, he didn't wake up, and so we didn't know why he died, and we did an autopsy examination. Well, when we did the autopsy examination, he actually had a aortic dissection. It started just above the aortic root and had spread into his carotid. So as it spread up into the carotid, that was probably referred pain from that dissection going up. That's what was causing his throat pain. So it probably started about a week beforehand. Now, 13-year-olds generally don't get aortic dissections, even like Marfan syndrome. We usually don't think of that until 20s or 30s if they're going to have it. So I talked to the family. Was there ever a history of sudden death in the family? Anything, related to the heart before? Because especially 20, 30, 40, 50 years ago, people may not have gotten autopsy exams. They may have never actually known what caused the death. That had just written heart disease down. So asked a lot of questions, and the family, the decedent actually had a 10-year-old sister, and she was absolutely terrified that this was going to happen to her. So I worked with the family, and I actually worked with an organization to be able to get them some genetic testing. And it turns out that mom had a single mutation in collagen, so Ehlers-Danlos syndrome, but she was just a carrier. Well, he had a second mutation, and the sister was tested and she didn't have it. So it was actually a de novo second mutation. So she was not at risk for it. She is a carrier, so she needs to be aware of that. But that's what resulted in his death. And it's these types of cases, the complex cases where we have to do more, that I find really rewarding. Again, it's not a happy case, but I was able to give an answer to a family, and I was able to let that sister be able to live more comfortably. Again, physiology ends at death, so sometimes it's an answer that we can't see. And one of the things you have to be okay with as a forensic pathologist, sometimes you're not going to be able to get to an answer. What are we looking at in the future? So digital pathology is touching everything. It's probably going to be a little bit slower to get adopted for forensics, just because of cost. I do not think robots are going to start doing autopsy examinations, but we are definitely moving in the direction where we're going to probably be doing less invasive and more centralized diagnostics to be able to get to an answer. Advanced imaging, forensic radiology is a passion of mine for sure. So in our new building that we're actually in the process of building and opening, hopefully by the end of the year, we have a CT scanner that'll be going in there. That's a great adjunct because there aren't enough forensic pathologists, so we have to figure out how to do the work more efficiently. And then genetics. I think that this is a field that is absolutely booming right now. And I think that it has the potential to really get us a lot more answers, especially in young deaths, in SIDS type deaths where we didn't have the ability to do this either because of cost or technology. We're going to be able to get more answers for people. Okay, so there's probably a bunch of you that are on here right now and be like, he's a forensic pathologist and he's told us like couple of cool cases, but there haven't even been any pictures to show stuff. So of course I had to include a cool case in here. So this is part of a series that I did called Forensic Pathology Fact or Fiction. And this is a case that I had, and we'll call it, I'll give it a thumbs up. So Winston-Salem Police Department, which is our local police department here, calls and they report the a case of unidentified human remains. So it's a late spring day. There's a construction crew out, and they moved in some fill earlier in the day so that way they could build an addition onto a home. Well, after lunch, the workers are out there clearing some of the larger rocks, and one of them finds something that they think looks like human remains, so they call the police department out there. The police department arrives, they cordon off the area, and they begin processing it for evidence. So our office gets a phone call, and they said, we found a human toe, or maybe it's a thumb. I'm like, well, if you don't know if it's toe or a thumb, it's probably just a rock. I have a high degree of suspicion in these sorts of things. So, and the other thing is construction projects are also notorious for unearthing historical human remains. So like, is this actually a bone that's been brought from somewhere else? It's not, it's not something that's forensically relevant, even though it may be relevant in some other way. And so we're like, send us a picture. We'll see if we really need to come out there or not. So they send us a picture. This is the actual picture. And lo and behold, that looks a lot like a thumb or the big toe. So, all right, I'm actually just been here in this job for about 6 months. I have a brand new death investigator, so we decided to go out to the scene. Well, it was a comedy of errors. I can tell you that. So I drove my car into a drainage ditch trying to get into the driveway because I didn't see it was full of weeds. We got that handled, but I was a little bit embarrassed. The area that the home was in was right next to two other residences. One of the residences was unoccupied, but the other one was occupied to the point that they thought that they were going to get their own CSI crime scene special. When I tell you that the entire family showed up, I mean, there were 25 plus people coming out of the woodwork. They had a tent like this one set up. They had a grill set up out there. They were getting ready for the show. They were going to be right there getting to see exactly how it really worked. So I start examining and I look and it looks just like a thumb. And I start uncovering it, and there's two other fingers attached to it. It's got a nail bed, it's got a nail. Like, I don't know what this is. So I start palpating it, and it's really thick and kind of leathery, and it doesn't have any bones in it. So now I'm thinking, like, could this be a degloving injury where there isn't a lot of tissue still attached, or is there something else going on? And all of a sudden, I figured it out, and I pulled this out of the ground, and law enforcement is really upset at me because I'm disturbing the evidence. They didn't get to take photos. It was actually a realistic looking glove. This is like a Halloween monkey or ape glove or something like that. And the way the nails were shaped and the way the fingers were sitting out there with those ridges in the dirt, they actually looked quite a bit like the real thing. So my favorite part was when law enforcement had to go over and tell this family that had collected there for the barbecue and their own personal CSI that this was not, in fact, going to be a dig or something really entertaining. And when I tell you that I heard an audible gasp from across the field, it was, I had to start laughing out loud. So this is a lot of the fun and some of the things that we do get to deal with. So, some of the fact versus fiction is most of the autopsies that we perform are actually determined to be natural deaths. Most medical examiners' offices, 50% or greater, are actually going to be people that died of natural causes. The job is not glamorous. It's not particularly lucrative. I don't have a badge. I don't have a gun. I don't get a Hummer. I don't have all of the best technology. It's not all solved within 15 minutes. There certainly can be an emotional toll. And so that is something to consider. Autopsies are not like cadaver lab. So if you do not want to become a forensic pathologist or you are scared of becoming a pathologist because of having to do autopsies, I highly encourage you to actually go and see one, either at a medical examiner's office or along with another pathologist, because cadaver lab is really nothing like what we do. And I did not like cadaver lab, and I became a forensic pathologist. It is very different. The smells are very different. Now, there are, of course, unpleasant smells, but that formalin formaldehyde smell is not what you're going to encounter. And there are a lot of it serves a different purpose. So a lot of people realize that it's really not about the same thing. And of course, this job can be gross. So, who is forensic pathology not a good fit for? Obviously, squeamish people. Those who can't adapt to the physical demands. There is a lot of lifting, a lot of moving around. I know plenty of forensic pathologists that have thrown their back out trying to do things. You may have to crawl into tight spaces if you have to go to scenes. So, there is a physical demand that goes with this job. The people who want to be justice warriors. This job is about objectively identifying information, whether that fits a scenario or not. Some of the most dangerous forensic pathologists are people who want to get to the answer that law enforcement or someone else wants to, and they will make facts fit in order to do that. None of us wants a potential child abuser to go free. But if there's any doubt that this could be something else, you need to chase that down, and you can't just let it go, because there are some disease entities that can present with bruising, that can present with easily broken bones. So you want to make sure that you're not actually breaking a family up for the wrong reason. If you have particular triggers, so, if you have someone that died in your family due to a violent act, this probably isn't the right thing for you. Or if you could compartmentalize that and decide it isn't, there are several residents that have come through our program that started wanting to be a forensic pathologist, and they had one case type, and it was just not something that they could see themselves dealing with in the long term. If you can't emotionally compartmentalize things. If you're very empathetic, I tend to be very empathetic, but not in the autopsy suite. Probably not a good fit for you. And then people that are hyper focused on forensics. Again, the first thing that you need to be is a good pathologist. Then you get to be a good forensic pathologist. So if you're still interested, what can you do? Get as much exposure as you can. Go see autopsies. You can follow forensic pathologists sometimes to court and go on scene investigations if you have the access to a death investigator. The National Association of Medical Examiners and the American Association of Forensic Sciences both have medical student um, level. I can't think of the word that I'm trying to find right now. You can join as a medical student in both organizations, and they're free. You can also go to their meetings if you have the opportunity to do that, and then find a mentor. Get into research, find other experiences that you may have to be able to get out there. And a lot of times we all have interesting cases that can be written up or go to a meeting, something like that. What to look for in a residency program: solid, well-rounded training, good board pass rates, everything that you would look for generally in a regular residency. A residency that matches people into forensic pathology is key, and it has opportunities to rotate through medical examiner coroner's offices. Not everybody does. In some offices, you actually can't perform autopsies because of the way that state laws are written, so you're just a glorified shadower. And then if you have an affiliation with a fellowship program, that's obviously a plus too. So just wanted to end things off with a couple of cool photos. So the left one here, these are all real autopsy photos, is actually a coronary artery thrombus in a coronary artery aneurysm from Kawasaki disease. The one on the right is a gunshot wound, but it has this really interesting kind of galaxy-like pattern to it. The ammunition that was used, the outer coating on it called the jacket, the way that it is formed, it was actually electroplated onto the outer metal was electroplated onto the inner metal, and that caused it to break off as it was flying through the air. So you actually get little pieces of metal embedded in the skin. So even though this is not a happy case, there's still some beauty to be seen in forensic pathology. Obviously, I'm interested in forensic radiology. So this is a CT scout film of a 22 bullet in an individual, and you can see that there is a large hemopneumothorax in that same individual. You can also find bullets that way. This is a 3D rendering of a gunshot wound coming through bone on the left-hand side. And then on the right-hand side, this is an individual who we had CT scan. And most interestingly, I actually missed this during the initial review of the CT scan, but we found it at autopsy. You'll notice that there's a metal canister sitting up outside of the body, and it's actually hollow on the inside. So that's actually a flashlight. And inside the flashlight was a little bindle containing their drugs. And I did not know that that was something that people did at the time. But when we took the flashlight out and moved it, we could hear something in there, opened it up, and then found the drugs in there. So that was something that not only do you have to look in the deceased, but you also need to look in their belongings. That was an important lesson for me. So we're going to open it up to questions. I did go a little over time, so I apologize for that. And of course, dog tax. This is my elderly dog, Cooper. He's 14 now, and we call this his Clint Eastwood stare because he just kind of stares off into the distance, sometimes for long periods of time, and I'm not sure why. In addition, I also wanted to really quickly plug the Path Scholars Program, which Seth mentioned earlier. It is designed for medical students of any year, generally first and second years, but if you're a third year or you want to knock it out before you can knock it out pretty quick if you really wanted to before it becomes interview season. You certainly could do that too if you're interested in learning more. It's an immersive hands-on program. It is, again, designed for medical students. So if you're already beyond that stage, it's probably not going to be that helpful for you. But you can email pathscholarsprogram@gmail.com. That's going to come to me. I just like to keep them all there. And then if you have just other generic questions or want to email me at my regular email, that's markgiffen@advocatehealth.org. So with that, I will turn it over to questions if anybody has them.
Thank you, Dr. Giffen. That was so interesting. I came in with a whole list of questions and you answered just about all of them. But one question I did have for you is what advice do you wish you had received earlier in your training?
So for me, I think for advice for me, it would have been don't be afraid to ask questions. And I think I see that a lot, even in our trainees now. Don't be afraid to ask questions. Don't be afraid to be wrong. The time to be wrong is now. you are a medical student or a post grad trainee or even a pre med. I don't know what we've got in the room here. I recognize a few names. Um, but the time to ask questions is when it's not on your shoulders. It doesn't matter if you feel stupid. You doesn't matter if you think you should know something. If you don't know it, you need to learn it. And I think that that's a hard hurdle for a lot of people to get over. Now, obviously, you don't want to ask all of the questions all of the time. You want to meter them out, and get that. But the time to make mistakes is during your training, and the time to be wrong is during your training, and the time to ask those questions is during your training, because you don't want to get out on the far side and realize you don't know those things. And that would be some advice that I would give to myself in the future.
Thank you very much for that. I fully agree with what you just said as well. We do have a question in the chat. What is the most challenging part of determining a cause of death when the evidence is limited?
That's a really good question. So cause of death and manner of death are obviously two different things. Cause of death is the underlying disease process or injury that results in death. Most of the time, greater than 95% of the time, we can get to an actual answer there. It's that 5% of the time where it's maybe we do know, maybe we don't know. And in those sorts of situations, we go with common things being common. So if I've got two alternate theories about how something happened, whether it's the natural disease process or it's an injury or something like that, you got to pick what most likely happened. And sometimes, you can put both. You don't have to just pick one. The death certificate is designed in such a way that you can pick more than one. We call them other significant contributing factors. So, for example, maybe somebody has really bad heart disease and they have a really low level of cocaine. Well, that low level of cocaine may not necessarily kill somebody else, but the heart disease really didn't help. So it's being able to take all of those pieces and kind of weighing them against one another. It can be really frustrating though when you get to that 1%. Where you just don't know. And that's why undetermined cause and manner of there. I don't ever consider an undetermined cause or manner a final diagnosis. I consider that a undetermined until additional information may come about. Now, we've had cases where we have somebody who just exhibited all the signs and symptoms of a drug overdose, and they got treated like a drug overdose and they died. And then we do a toxicology screen and there's nothing there. And then 6 months later, we get an updated toxicology screen, and all of a sudden we have something in their system because they couldn't test for it. They didn't know this drug existed because it's not a shotgun panel. There are specific things that we test for. So there's always an additional test that may come out in the future. And so it's those sorts of cases. Now, for manner of death, that being the how the injury or natural disease process occurred, that depends a lot on other people. We don't do all of the investigation. So that depends somewhat on law enforcement. That depends on family members being truthful and giving us all the information. That depends on us being able to get records of things. Sometimes we can't. Going again with the most reasonable and best answer. And sometimes if we don't know, undetermined is still a reasonable solution to that. Sometimes, if I have an individual who died of an injury and I don't know how they got that injury, whether it was inflicted or it was, inflicted by somebody else or inflicted by themselves, it may just go out as undetermined because we'll never be able to get that information. You just kind of have to get to the point where you're okay with that at some point. But you want to make sure you go to the length of ruling out as many of the other possibilities as possible.
And we have another question in the chat. Are locums a possibility when practicing as a forensic pathologist, or would that get too complicated with deposition and court scheduling?
That's a really good question. Locums is huge in forensic pathology right now. Obviously, with not having enough of us, we can't be in all of the places at all the time. And some offices are actually set up, you may be on service for 2 weeks and then off service for 2 weeks. And some people will take a locums position for a week and go somewhere. People fluctuate through offices, so sometimes you may be down a person. So locums is absolutely something that you can do. I usually recommend to people not to go out and do locums right out of fellowship. The main reason for that is you want to kind of get yourself settled and feel comfortable in the work, have some experience before you go some places. And as a locums, you can do anything from you just want to do straightforward natural deaths or drug overdoses in an office to being willing to do complicated homicides and pediatric cases. And for those things, you get compensated when you go and testify in those jurisdictions. There may be, having to work with the offices that you're in, depending upon when that is. Like our jurisdictions here are really good about, me telling them like, I'm going to be out of the office for these 3 days, but I'll be back the rest of the time. So they'll make sure not to call me on those 3 days. So you can oftentimes work around those sorts of things. It can at times get complex, and not every jurisdiction is good about that. Oftentimes, the more complex the case, the more you get paid for it. So there is a little bit of that, and then there, are other fees associated with the travel and doing those sorts of things. Same thing as consulting. Like my consulting fees are not the same as my criminal testimony fees; they tend to be higher. And that's because they are often more complex cases. I am reviewing notes rather than doing things directly. It is on my own free time. And so, there's a lot of logistics. There are actually companies out there that you can contract with to do locums. And there are some people that have just transitioned to doing just locums. Some people will also do locums sort of as either a retirement or a side gig. I have family in X city, so I want to go there a week a month, and I get to spend time with them while I'm working, making a little extra money on the side, and I'll maintain, a residence there or something like that. So there's a lot of different options that you can kind of manage and work with in that realm as well. Somebody said they wanted to hear more from me. Be very careful about that because I can talk a whole lot. If you are interested, I would say, not necessarily just me. I actually just did a talk for the National Association of Medical Examiners. They have a whole series of webinars on forensics. And you can also go to forensicpathologyeducation.org, and they have a whole series of the webinars that have been pre-recorded that you can actually view them there. The National Association of Medical Examiners, which is the name.org, also has those webinars available, so you can hear a lot more about forensics from them. And then also just seeking out opportunities from local medical examiners. A lot of us like having students and trainees in our offices. And so if you want to see a little bit more about people like me, like I said, I think a lot of us are pretty cool people. So
And on that note, thank you so much, Dr. Giffen, for your time, for this great presentation. If anyone has any last minute questions, please ask them now. But otherwise, I think I'm good with saying have a great night, everyone.
thank you, everyone. It was very, very nice to be here and get to educate you all.
Thank you again.